applicants. But to get started, can we go around and just get an introduction of who is on the phone? And Richard, I'll start with you.
Yeah, Richard Donaldson from Samaritan Hospital and Clinic.
Tracy, you want to go?
This is Tracy Miller. I am with Mid-Valley Clinic and Hospital.
Kelly, if I'm saying that correct. And Kelly, Steffens, I see your name on here. I don't know if you can talk or not. If you ever have anything, you can type in the chat function if you can't talk. And then the other person I see on here is Vicky.
Vicky Polhamus, Columbia Basin Hospital.
All right.
Can you guys hear me now?
We can.
Okay, this is Kelly from Cooley Medical Center.
Okay. All right. So as a whole, for all of you, I created a slide deck just to review some of the basics of the application. I know Tracy, Vicky, and Richard, you've been more involved in this from the start, so you probably, some of this might be basic stuff. So we're going to review the timeline for evaluations, review the sections, and have some time for questions. On the slide deck, I'm going to show some of the scoring criteria for the application. And again, if you've been part of the Transitional Care Diversion Intervention work group that's developed this, you've seen the application scoring sheets. And so you have a little bit of how it is. Kelly, I know you probably have not seen this stuff, so we will be sending out, again, the application, the recording, and the evaluation sheet that we've created for the applications, just so that everyone is on the same page on what they would be getting scored moving forward.
Super.
If you guys have any questions, feel free to inject. This is really your time to get your questions answered. And so I tried to provide a format to be informative, but I rather make sure that you're getting what you need answered. So just a quick review of the evaluation timeline. Applications are due September 28th by 5 p.m., and that's a Friday. Starting in October 1st through 12th, scoring will be completed by the reviewers. So I'll go through some of the review team process, but we have a total of 6 reviewers. We are going to have 3 reviewing 5 applications and another 3 reviewing another 5 applications. October 15th through 26th, we're going to share initial scores with partners, and this will be a time for partners to see the comments and the scores that outline their strengths, their weaknesses, and where additional information needs to be included. So an NCHCH staff will follow up with those partners to share the score and the comments, request for any additional information. If a meeting needs to be scheduled with hospital organizations to go around scores and timelines for implementation, that will be talked about. And I think really on the timeline, some of it will be, especially for transitional care management, when we want to schedule some of that training for your organization's transitional care management nurses, or with CMT for any EPIC training or integration. And then at that point, my hope is to send out a draft memorandum of understanding just to get started with the process. I know organizations are different, and some people can review it, sign it. Some people have to start bringing some of the legal stuff through their legal team, and that takes longer. So just to get that process starting, we're going to have draft MOUs developed. And those drafts, MOUs, will probably have some level of consistency across all the partners, especially for the first round, but then it'll be tweaked specific to some of the language in the application. I would say one of the keys behind this is that these aren't really competitive hospital-to-hospital applications. It's just you have an up to max you can earn. And so our goal is to make every hospital successful, but put some level or some bar out there so that we're just not accepting anything. October 29th through November 2nd, reviewers will have a chance to review any additional information that was submitted by the organization, talk about those changes and adjust scores as needed. And then November 3rd, final scores would be provided to partners after reviews complete the final application. And November 5th, my hope would be to have final MOUs out there. If we can sign them November 5th, that's great. If there's some tweaks that need to be done the week or two in November, we can get that done as well. Any questions on that timeline? All right. The hospital application review process. So again, I said we're going to have a total of 6 people review applications, 2 staff, 2 work group members, and 2 technical assistance consultants that we have through OHSU. And each reviewer will score 5 applications, so 3 reviewers per application. And we'll have a process in place on how we randomize who scores what application, so there's a mix of people reviewing them. So really, I'm going to run through all the different sections. Section 1 is really just asking you for that basic information. So it's either complete or incomplete. I'm hoping everyone can fill out the form that's requested and just put in the information that needs to be there. If not, we're going to send it back and request that you complete this section. We have to have some form of scoring for it, so you just need to have it complete, or we're not going to pass the application until you fill it all out.
Can I interrupt real quick?
Yeah.
This is Kelly. On that check priorities organization is participating in, are we only allowed to choose one, or can we choose both?
You can choose both.
Okay.
Yep. Yeah. So the meat of the application is really the transitional care management and the ED diversion sections. So we need to verify that you're going to choose at least one of those. If you're not going to do transitional care management or emergency department diversion, there's really no point in applying. So we just want to confirm that you're doing at least one of them. You can do both.
Okay, thank you.
So then section 2 through 4 is really the crux of the application. And so really, like you just said, Kelly, participants must choose and pass at least one of the following sections to receive funding. So you either have to be doing transitional care management or ED diversion to get funding for the application. Section 4 is titled community-based integration. And that's really looking at how are you taking those projects and intertwining them into the community and doing work with community partners. And so for those of you who have not been part of the work group, there's been a strong emphasis in regards to not making these standalone projects that are only done within the confines of the hospital organization. But how do we encourage people to get out and partner with their community partners, whether it's primary care or community-based organizations? And section 4 is going to be focused on that. So each of the 3 sections, 2, 3, and 4, are scored individually. And so if a partner passes 2 of the 3 sections, as long as they pass either section 2 or section 3, they will still receive funding for the application. So Kelly, to your point, let's say you pass section 2, you for some reason don't pass section 3, and then you also get funding through section 4. We'll still fund you based on the section 2 and section 4 submissions, but you just won't be funding for section 3.
Okay.
But you really do need to pass either section 2 or section 3. The point of the application is to do transitional care or ED work.
Perfect.
Does that make sense? I know it's simple but complicated at the same time.
Yeah, well, and I think that we're already doing both of those, or at least trying to get all that stuff together. And so we wanted to build more and make sure that they both meet the criteria, and then we can do it all across the board. So we're definitely going to try to whip them both out.
And I would say we understand that every hospital organization is at a different point in both of these sections and throughout our conversations with everyone that's come to light. And so we understand that you might be doing it at some level. Our goal is really to help everyone, and especially around transitional care management. That's probably the most evident. We're helping everyone try to get a regional standard and program set up. So this slide is just to give kind of a overview of some of the what Section 2 through Section 4 scoring will look like. And this is actually pulled out of the first two scoring questions for transitional care management. And so each section is going to be worth 50 points. And then within each of those sections, we're going to have what you call subsection scoring on the sheets related to the questions in the application. So if you look at the image to the bottom right, you'll see there's project description part 1 and project description part 2. And so what we're looking at in part 1 is, does the applicant clearly articulate the proposed project? And Kelly, to your point, specifically, does that clarify and clarity include the current state of the transitional care management program they're doing in their organization and how they're going to move forward to what's outlined in the application? And then we have a specific model for transitional care management, so we want to know that that organization is clearly staying in alignment with that model. And if for some reason they're deviating from the model we're providing, there needs to be some very sufficient justification behind that. So as you see, each section will have specific questions that the reviewers are looking at and scoring that section based on that. Those questions and those subsections might be weighted differently. So as you can see, project description part 1 is weighted twice as heavy as project description number 2. I'll say, and I'll get to the actual scoring range on this, but each subsection is scored on a 1 to 5 scale, with 1 being the lowest and 5 being the highest. So an example for project description part 1, if someone scores a 4, their total points is 8. If they score a 2, their total points is 4. And then, like I said, at the end of each section, reviewers will have an opportunity to provide comments on strengths, weaknesses, and if more information is required. Any questions on that? And this is, even though some of the subsection questions are different in sections 2, 3, and 4 on the scoring sheets, this general format is the same. So you'll see the section, the subsection, description, questions, and scoring and weighting, and each one of them are worth 50 points. So then how are they going to review the difference between 1 and 5? So reviewers will rank subsections based on the following scoring criteria. And so 1 is poor, very few strengths and numerous major weaknesses. 2 is fair, with some strengths, but at least 1 major weakness. 3 is good, a blend of strong elements and moderate weaknesses. 4 is very good, mostly strong with minor weaknesses, and 5 is exceptional, strong across the board with essentially no weaknesses. And so as they're reviewing the responses to the question, this is what they're going to be scoring you based off of. So just to highlight some things as you're applying for each section, I'm just going to call these tips to think about as you're writing your application. So the transitional care management section, section 2, this is a very specific model that we're providing. There's not a whole lot of flexibility behind it. So really, partners really do not have much flexibility between altering the model. And if you do, you need to make sure that that's really well explained. As a note, training of staff on the model will be available through Confluence Health. And so we have, and this is as you're developing your budgets to think about, we are contracting with Confluence Health outside of the funding that you guys are receiving to provide that regional training on the transitional care management model. We will have to work with them in each organization to lay out the exact timing in regards to when staff can come on site to Confluence Health to receive that training, and then their experts are willing to come on site to the organization to also review internally how that organization has implemented that program. If for some reason you are trying to submit another model, we're not funding that. So we have already kind of chosen the model that we're doing and the training partner, and we will pay for it if you go that route. If there was good justification to select another model and you're going a different route, you're responsible for finding that organization, contracting with them, and paying for those fees. Sustainability and budget are heavily weighted in this section, and I think the main thing that we are looking at is how the transitional care management nurse position will be sustainable in the future. So again, I know you got all organizations are providing the service in different arrays and have nurses doing it in some way or not. We just want to make sure that there's a level of commitment that if we're going to give you the funding to get this up and running, that you're not going to do it for a year and then remove the position that's doing the work. And then finally, we do have some funding, and when we approved the budget with our board, we do have some funding allocated to help pay for some of that certification and training process online. And so the example is the American Case Management Association has a case management training program and certification online that people can go through, and we've reserved some funds for your guys as transitional care management nurses to go through and get certified under that training program. And we haven't specifically landed on the American Case Management Association program, but that was an example that we used, and we have some funding for that. So can I ask, is there any questions on that specific to the transitional care management section?
So, this is Vicki. I do have a question. So, what did I see here? Somewhere in that resource guide that you sent us, so basically, as long as we're following the bullet point that says what is transitional care management and the criteria for that, then we are following that plan, correct?
Yeah, if you basically took the resource guide and implemented it, and I accept the fact that you're going to have a few small tweaks within your organization. You're pretty much implementing the plan. You're going to be fine.
Okay, that's what I thought, but I wasn't sure. Okay.
Please put more in your application than you're just following the resource guide, though.
Yeah, I got that. I got it. But I just wanted to make sure, because I know, they do a lot of things with case management and inpatient and outpatient and all that probably we won't do because we're smaller. But the transitional care piece, we're definitely going to be following and doing that piece. So I just wanted to make sure I was on the right page.
And just as an FYI, because I talked to Lori Bergman from Confluence, and I know a number of you know her, about providing over the course of the next year, them helping provide even webinar technical assistance to cover like some of the patient safety stuff that they've gone through and some of the billing stuff. So the hope too is as well throughout the next year that as the organizations are implementing the model, we also have a chance for everyone to come together and talk about specific components of the model that are getting developed so everyone can learn from each other.
Awesome.
Other questions? All right, and if you have any in the end, you can reserve them. You can bring it up too. And I don't have it on the screen right now, but I have the application and scoring sheets on my computer that I can bring up if you want to look, if we ever want to look specifically at either of those two.
John, I'm sorry.
Go ahead.
It's Richard. I just had a question about maternity support. So we have been doing some callbacks, but not with the OB population. We haven't really seen the issue as far as readmissions with that population, but we're willing to look at that to include for the purposes of this application. One question, it does say if you have folks involved in other case management programs, we do have our higher risk OB patients in a maternity support program. I was just wondering if that would be considered a case management type of program, or if we should still be calling on those folks.
Are they being followed up? So once they're discharged, they're being followed up by case management?
Yeah, it's a support services for maternity.
And so they'd get discharged, and then they'd go into their follow-up appointment, and then case management would see them, or would case management follow up with them even before they get into their follow-up discharge appointment?
Yeah, well, I'll have to follow up and see what that process is for maternity support services. Traditionally, we haven't really called them a case management program, but they do, some of the elements of that follow-up to make sure that, especially with feeding issues for newborns, are being monitored. So that might be a question I can ask Confluence, but I was just wondering what defines a case management program.
I would say what would define, and this, again, I'm going to make this clear to everyone that I'm not a clinical case manager or been in that department, but anything, the transitional care management program and model really is a follow-up until they pretty much get to their outpatient appointment. And then if there's case management after that, they'd move into case management. And so anything that really extends beyond that initial transition between hospital to follow-up appointment, I consider that case management, at least for the confines of differing it between this model.
Okay, thanks.
So a few key highlights really to point out on the emergency department diversion side is we've really chosen some main approaches to select, and you can see those at the bottom. But I would say within those approaches, we are actually providing probably a little more flexibility within this section for responses to tailor it more to your individual organization. And so you'll see, and don't look at this verbatim at the bottom because there's more detail in the application. Reduce and appropriate ED visits, patient education on access to care, training staff on utilizing the EDI system, and integrate EDI into EMR. So those are the four, and those are like very broad-based statements versus what's in the application, but those are the four main things. And so but the things to note as you're filling out your application section is each response should clearly articulate the work partners are doing in each selected approach they choose. So based on those four below, as you're filling out your application, please be clear on when you're talking about which approach you select. So don't get too muddied where as a reviewer is going to review this and they're not for sure if you're talking about patient education or EDI training and working EDI into your workflow. And then the score for each section should reflect how the partner adequately responds to the questions for each selected approach. So as we go, and I'm going to go back because I can't remember if I finished. As you look again at how our reviewers are going to review section 3, we don't have it broken down to where you see project description part 1, approach 1, score, approach 2, score, approach 3. So how you respond or articulate how you're going to implement any of these approaches is all going to be put together for your final score. So you really want to be clear, and also, if you do, I think the other way to say it is if you articulate how you're going to implement one approach poorly, and you write how you're going to implement one approach really well, the poor one's going to influence your overall score. I did want to point out that training staff on utilizing the EDI system and integrating EDI into the EMR can be two separate things. You don't have to integrate Eddie into your EMR to have training available to your staff on how to utilize Eddie into your current workflow. And if you are doing a bang-up job integrating Eddie in your workflow already and you just need integration, we can support that as well. I would assume that once you integrate it into your EMR, that your workflow is going to be slightly different, so you're going to want assistance on that anyways. But I don't want people to feel like they have to integrate Eddie into their health record system to be able to receive support training their staff on it. I know every hospital and their EMRs are different, and they're at different stages of where they're going with them. And so there is still support on how to utilize the Eddie system, even if it's not integrated. Any questions on the emergency department diversion section?
It's Richard. I have a couple of questions, John. Yeah, the first is on integrating Eddie into the EMR. Probably late next year, we're going to change our EMR. So I would look at integrating our Eddie into the EMR late next year, probably continuing through to the following year. So can I, on the application, document that it's our intent to integrate the Eddie into the EMR, maybe with a planning phase for next year, but probably not fully integrated until maybe after the end of the application, the expired time for this project? That be acceptable?
I would say yes, because the intent is to help partners through that, but let me follow up just to confirm that in kind of like a formal response and just over the webinar. I want to put that in writing so that everyone's clear on how that would occur. But I would say as long as you're going through the process at the end of the next year, that should be fine. And if it's going into 2020, or if there's a hospital that isn't really going to address it till 2020, I want to have a conversation more internally as a team on if we're willing to take the funding that we had allocated through 2019 and just reserve that as a pot of money for organizations that are going to use it later on in the future.
Okay. My other question is specific more to the population of ED patients and setting up the follow-up appointment. The application says to ensure each appropriate patient discharged from the hospital has a referral. When you use the word appropriate, does that then allow us to define the population of what we consider to be appropriate? I'm just wondering if every patient, we see, I don't know, 1,800 patients a month, if the requirement is for each patient to have a referral or a follow-up appointment being set up, or is there selection?
I think the reason why appropriate got put in is because there's an understanding that every patient that goes to the ED doesn't necessarily require a follow-up. And again, maybe one of the ED partners can help on this one, but my understanding would be if there's a general process and protocol in place in regards to what patients should we receive follow-up care after discharge from the ED, and those patients would fall under that definition of appropriate. Am I making and someone please, again, I'm not claiming to be the expert on this, so am I making a statement wrong there?
I think that was what I was looking at, is who is appropriate or based on our protocol and the process or policy that we have on who we get the follow-up calls for. So I think you're on with what appropriate is.
Okay. Richard, do you have other questions?
No, those are just the two questions, John.
Okay. Anyone else have other questions on this section?
So I have a question about training the staff on to utilize the EDDI system. So we talked about this way earlier on in the early springtime, but do we have any kind of dates or anything set up with that for those of us that want to do it? Because I'm looking at how, I mean, we need to have a progress report done by December 31st, and kind of how we're going to do this when we don't really have a date on when we can even get started with that for training the staff.
So we've talked with Collective Medical Technology, CMT, about this because they do have staff available to provide training on the, especially, we've talked with them, I will say, both on the EDDI and the pre-managed side, and they're more set to assist on the EDDI side. We don't have specific dates at this point, to be honest, but I'll send a follow-up to them and see if I can get something in the next week or so that provides some level of commitment on how, even if they don't provide specific dates, how quickly they can react if an organization requests it.
Okay, because I know we will be requesting some of that just because we've had such a turnover in the time that I've been here. Yeah, that is one of our approaches that we're going to go to. And so if we can kind of have if you give us a 2-week notice, whatever, we can be ready, or it's a 6-month notice, before we can educate, that would be awesome to find that out.
Okay. I'll see if I can get that in the next week. I owe you guys that.
Okay, thank you.
John, Vicki, I saw on the NCACH website, I believe, there is some training that's called EDDI for Beginners, and it's put on by CMT, and it's September 6th at 10 a.m.
Yes, I have it down to go to listen to that. Thank you, Richard.
Yeah, EDDI provides, CMT provides monthly training webinars for EDDI and pre-manage, and that's kind of a good starting point, but then they do also come on site and provide individual training for the organizations as well. So I encourage both. And they do it, CMT, to be honest, does it free of charge. So the cost associated with the work really comes to the organization itself, staff time to get trained on the system.
Right, okay.
All right, section 4, the community-based integration section. This section, as I said earlier, should tie with the work you're doing with your organization's TCM or ED diversion sections. So again, really the hope and why this got developed in the work group was that you're taking the work you're doing with your transitional care management and ED diversion and collaborating with partners outside of your organization to, really strengthen and make this work more effective. So really you need to demonstrate how you will collaborate with other healthcare and community-based providers in the region, and how well you demonstrate you are creating new collaborations or expanding on current collaborative efforts is really where you're going to get judged on. Budget does receive a large focus in this section because, again, I think as we've talked about this, we want to know how you're utilizing the funds to create additional collaborative efforts. And one of the concerns, to be honest, that came up as we discussed the development of this section is that an organization would apply, they'd hold a few gatherings of community partners, claim that as the work done, and then just take the money. And so there's really a scrutiny on how the money is benefiting the community versus just going into the organization to hold a few meetings. And then really I wanted to point out, again, this is a snippet of the scoring criteria for that section. But really when you look at description part 1 and project budget, that's 5 out of the 10 weighted points in this section, and that makes up about 50% of the applicant score for this section. So again, it's really heavily focused on how are you taking the funding and bringing this out to the community versus just keeping this internal. Any questions on this section? And I would.
Oh, sorry, John. I have trouble finding my mute button, so just take me a moment. When I'm looking at the budget as such and looking at, it looks a lot of labor, probably labor for us. You know, for care transitions, ED diversion, even the community-based integration is, you know, it's probably just more someone dedicated to reach out to our local agencies and, you know, whether it's setting up follow-up appointments or watching the eddies and you know, setting up plans of care in the eddy programs. So is it going to look unusual on your side if that's really heavy weighted in the budget information that I'm going to put in the application?
I would say if it turns to be heavily staff weighted, what you really want to do is define how that's benefiting the greater community that you're doing this with. And so you're, as you say, you're reaching out to community partners to make some of these connections. So let's say you're paying for a staff person to, and this is, I don't know, I'm just using this as an example, to reach out to a community organization so that when you discharge them from the ED, that they get a referral there to help them get hooked up with services. You may be spending the money on that staff person to get that done, but you need them. I would say you just want to be clear that one of the goals there is to establish a referral process that will then go to that organization so that they're getting connected with the patients directly versus having to hunt them down and figure that out. And so we really want to know if you're spending that money internally on staff coordination and that what's the external benefit there, and how is that really enhancing your work with the partners? And I know you can't write that in dollar amounts, so just make sure you're explaining that in that section.
Tim? Yeah, they're full. It's because the clinic is closed.
And Marissa, you're not on mute. All right, any other questions on this section? I would encourage you guys to read through this, and then when I send out the scoring sheet, read through the scoring sheet, and please submit questions if you have them, because it is, you know, when you get to, you know, the transition in ED, it's very program project focused, and this is one of those. I mean, it's still relatively clear cut in what you're doing, but it's just one of those more gray areas when you write things. So just if you have them, please make sure you submit them in advance, and we'll get you those responses. So then section 5 is measurement and evaluation. And this is really looking at how are you going to collect data and evaluate your program to make sure the work that you're doing is effective. So the applicant must pass every subsection to receive funding in this. And so within, and I will be showing you the scoring sheet or a snippet of the scoring sheet next, but within each subsection, you want to consider the following when answering: does the organization have a way to track the measure? If they currently do not have a way to track a measure, do they clearly explain their plan to start the process or provide an alternative proxy measure to track the work? And really, within the application, we do allow you to put not applicable if a measure is not applicable to the work you're doing, because some of the measures listed in this section are more focused on transitional care management, and some of the measures in this section are focused on ED diversion. But just because the option of not applicable is there does not mean you can select not applicable for everything and pass this section. So you really need to ensure that you're identifying a measure to track for success for the projects you're doing. And so the measures that are in the application, as you can see here, look at follow-up post-hospitalization, all-cause hospital readmissions, decrease in unnecessary outpatient emergency department visits, tracking patients with 5 or more ED department visits in a calendar year, and you are able to provide additional measures as defined by the organization. So if you feel like you have other measures that are really useful, you can also put that in there. I put on the right-hand side of this presentation really where the key project is associated with that, so whether it's PCM or ED diversion, just so you guys have an understanding of what project or what section you would be probably looking at, either answering these measures or providing a proxy measure for. And then at the end, it's just attestating that you understand and accept the responsibilities and requirements for reporting. And so that's the semi-annual reports we're going to ask you to be submitting. And I think to someone's point, I understand that December is going to be very quick after this application process actually gets started. And so I'll take a look at that and get some additional probably details on what to expect on the things you'd want to report in December. Because I know you're going to be just getting into the starting process of a lot of this stuff. Any questions on the measurement section? All right. So then final evaluation sheet. On the last sheet of the paper, this is really what the scoring looks like for each organization on that final sheet. So section 1, pass or fail. Did you fill the information out? If not, you need to fill it out. Section 2 and section 3, like I said, total points available in each section is 50. To pass, you need to get at least 30 points in that section. So we're starting at about a 60% score to pass each of those sections. Section 4, community-based integration. We did a little bit more of a tiering scale for this section. So as long as you get 60% or higher, you'll get some form of funding. If you get 30 to 40 points, you get 70%. If you get 41 to 50 points, you get 100% of your requested funding. This is really to provide a little more scrutiny to this section to ensure that if partners are reaching out to the community, those who have really good plans on how they're going to collaborate with community members get incentivized to do that. And then section 4, again, you either pass, or section 5, I apologize, you either pass or fail that section. So if you provide good metrics and you have a good way to track things, you pass. If not, you need to demonstrate how you're going to do that. Again, I want to emphasize that we do have a round between your first submission and final results to go through and talk about your application and look at how we can shore it up. And so if for some reason you are not passing a section, that's our time to evaluate why the reviewers thought you needed to strengthen things, where you can make changes, and then submit additional information to review your application and move it up to a passing score. So my questions to you guys is, A, do you have any questions overall on the application or any specific sections? And then also, are there just regional details you need prior to completing the application? So as Vicki pointed out, the CTM ability to train organizations on EDI workflow integration, that's something I need to follow up and get to you guys. Is there any other things out there you need me to send to you guys that you feel is information you need to be able to complete this application? So any questions or any things else you need to request?
Will you send out this slide or email it out so that I can also share it with the rest of my team?
Yep. I'll email the slide deck out, the application, and the scoring sheets, and then a recording of this today. So you'll have all those together. Depending on the file size, some of them might be links versus a direct file.
Thank you.
So John, it's Richard. So I haven't worked through the entire application yet. And I'm anticipating maybe some further follow-up questions on measurement. Are you the contact person or?
Yep.
Okay.
So you can always, I'm going to act as the contact person for any questions. If some of the measurements get detailed, you know, we have different technical expertise on our team focused on data, focused on, you know, a whole person care collaborative that I might seek additional input to help provide a response. But I'll have a very quick turnaround time. And then I'm going to put any questions into a frequently asked questions document. So if you ask a question, I won't obviously identify what organization asked it, but I'll provide a question and response so that every applicant has a chance to see the kinds of questions that have been asked and the response given. And I encourage everyone to read through and ask questions. My hope about doing this, you know, a little more than a month in advance is that it preps you guys to start thinking about what questions you have and gives you an opportunity to connect with me to help you along with the application process versus you submitting it, having all these questions in your head, or feeling like we didn't provide you enough details in the application. If no other questions, like I said, this session is recorded, so I will send it out to everyone. And then even the questions within the TA session, I am going to write up and send out as part of the frequently asked question as well. I'll be honest to say that I'm on vacation this next week, so you're probably going to see it more closely mid next week to end of next week before I have a chance to really dig into this. But I'm going to try to get that out as soon as possible. And then again, if you have any questions past this, please reach out to me and ask those questions via email or via phone. I will probably try to respond via email on any question asked, just because I want to make sure I have it typed up formally so you can read it after I send it out to you, and then I'd be providing that response to everyone as well. Any other questions, or does anyone want to look directly at the application form at this point, or the scoring form at all, or are we good?
I think we're good, John. Thank you so much for the webinar today.
All right. No problem. Thank you all for joining. Like I said, feel free to email me questions anytime, and then when I get the email out, feel free to respond. Again, Kelly, like you had said, share with anyone you want within the organization. I sent this out, when I sent the application and the materials out, I sent it out to all of the organization lead contacts that I had, as well as the original ones. I included everyone's either administrator or CEO so that they were aware of it as well. But other than that, thank you all for the time today, and look forward to working with you guys through this process.
Thanks, John.
Thank you.
Thanks, John.
You're welcome.